Okay. All right. Well, welcome to another edition of Revolutionaries by EmpoweRx. This is MK Bryan, the founder and CEO and host of the podcast. And today we have an amazing guest with us, Dawna Cato. And Dawna, I'd love for you to introduce yourself to the audience. Welcome.
Thank you so much. It is a pleasure to be here. I am Dawna Cato, and I am the current Chief Executive Officer for the Arizona State Nurses Association. And I'm so thrilled to be here. I've been a nurse in Arizona for about 25 years, almost my entire career, except for a very short stint where I was a Chief Nursing Officer in a hospital in Yinchuan, China. So after that, and with the event of COVID, I could no longer travel to China. So here I am as the CEO of the Arizona Nurses Association.
Wonderful. Yeah, I remember watching part of that journey because we connected on LinkedIn, and I was really excited to learn more about that and your time in China. Tell us a little bit about how that came about. And one of the main questions that I have about that is, what are, the similarities with your experience there working in that capacity, and what are some of the major differences kind of working in another country?
Sure. So that came about as I was in a role of a market director of professional development in a multi-hospital healthcare system, and the role was being eliminated. So I was challenged with finding other opportunities, and someone just asked me if I would be willing to go to China for 2 weeks, and I ended up being a 3-year adventure. But nursing is nursing, right? And
Mm-hmm.
fundamentally, it's the art and science of nursing, caring for patients in a compassionate way during their most vulnerable time. And so that was what I found in China as well. Now, some of their practices are a bit different. Certainly their culture is different. But fundamentally, they wanted to just care for the patients using the best practices that they could.
Wonderful. What an amazing experience. I'm sure you really grew personally and professionally from that. And now, kind of looking at what we're going through globally with the COVID-19 pandemic, I'm sure that experience is helping you now back here in the States with your role in the Arizona company.
Yes, so the Arizona Nurses Association is the voice of nursing across Arizona. We represent over 95,000 nurses. And one of our strategic plans with the Arizona Nurses Association, as well as the American Nursing Association, is to really highlight the value of nursing across the healthcare sector. Oftentimes you will hear individuals say, I don't know what a nurse does, or even those that are working directly with us, our colleagues alongside in the healthcare practice area. And so we really want to start to be able to articulate the value of nursing and elevate the value of nursing as fundamental to our healthcare system in the United States and around the world.
Absolutely. I know myself personally, I'm not a nurse, but I work with a lot of nurses and got into this, realm, with starting a company in the staffing vertical by going back to school to be a nurse. And so I have a tremendous amount of love and respect for the profession. And that is one of the things that I agree completely. So many people don't realize that, nurses are really the backbone of our healthcare system in so many capacities. So often people think of different providers like doctors and things like that, but nurses really make the wheels turn. And I think that's really important to be a voice for them and to make sure that we're advocating for them. I know we're doing that in our own little way. And of course, you doing that for the 95,000 folks there in Arizona is amazing. So talking about, nursing, I know, kind of circling to some of the focuses that we have, with EmpoweRx, I'd love to get your take on, some of the things that you feel nurses feel underrepresented, whether they're staff nurses or a lot of the folks that we deal with and a lot of the folks in our audience are traveling nurses. Many of them go to Arizona, to work in those health systems. And so, staffing, of course, is such a big conversation because of patient ratios and long hours and burnout and all of those factors. So tell us a little bit about, your feedback from the Arizona nurses and what you and your organization is doing to look at those aspects of the industry.
Sure. So it was interesting. Just yesterday came across my desk was that Arizona was one of the best places to work as a nurse. It was a
That's
national study done, and that report came out yesterday. So we're thrilled
that's awesome.
that we can claim fame to that.
Yeah.
And we also know that staffing is a wicked problem, right? It
Yeah.
probably will never be solved. There's so many variables that go into staffing hospitals and healthcare clinics and practices that serve our communities. And so I think, though, with the pandemic, that it's been a catalyst for change on how we look at staffing,
Mhm.
innovative ideas on how we do staff, optimizing other allied healthcare professionals in those staffing matrices. So it's going to be really interesting to see what happens within the next 5 or 10 years as we really begin to understand the role of the nurse, get them back to being able to really do the art and science of nursing,
Mhm.
and augment that role with allied healthcare professionals.
Yeah, wonderful. That's great. I agree totally that it has been a great catalyst for change, just kind of looking at the positive aspects that we can take from the learning experience. And I completely wholeheartedly agree in my perspective from what I've seen, that that's going to be the case for COVID and staffing. What do you see and what have you observed or heard from the folks that you work with as far as, Arizona being such a wonderful place for nurses to work, which is such an awesome thing for you guys to be able to tout. But we've heard, kind of nationally looking at a lot of staff nurses really have kind of jumped ship from those staff positions because of the huge pay packages being offered during the pandemic, especially obviously at the height of the pandemic with, high caseloads in certain areas being hot zones. Have you guys seen any of that happening in Arizona, or because of the great retention efforts and, good place to work, has that not been as much of an issue for you guys?
Well, sure. I think it's been an issue, nationally, right? And who's to blame? The nurse, right? Of course, they're
No.
going to take other opportunities.
Yeah.
Um, but I think that it's just important to recognize that those opportunities also bring opportunities for growth as professionals.
Mhm.
I actually did some travel nursing myself when I was at the bedside, and learned so much by being able to go into different practice arenas,
Mhm.
identify their best practices, and maybe take them back and implement them into other areas.
Yeah.
So travel nursing is certainly a segment of our workforce that is needed.
Mhm.
And I highly respect those nurses that can have the flexibility, the resiliency, and the adaptability to go into foreign places. Um, this, especially since I've done international work, but it takes a strong nurse to be able to go in and adapt and provide the highest level of quality care in hospitals that with a multitude differences of resources and things that they need to do their job. So
Right.
highly respect the travel nursing. I think that we really need them. And I think that it provides opportunity for growth. And, certainly like me, I don't know what the percentage is, but I'm assuming that there is a certain percentage of nurses that eventually find their home
Yeah.
and and then can really settle in. But we
Yeah.
thank those travel nurses that are out there and filling those gaps as necessary.
Oh, absolutely, absolutely. And I know that a lot of folks really talk about that being able to, learn so many new skills and soft skills too. It's clinical skills for sure, but also like being able to just implement yourself and kind of dive into new team dynamics and things like that. So it is really a holistic, way to build a lot of different skill sets. So I totally agree with that. And I also agree that I think that, you kind of see that we might sell this big spike, but I think eventually things will kind of balance back out again and people will go back home or maybe find a new home, through the traveling. And I think that those numbers will balance back out as we all start to balance back out in all the aspects that have been uprooted through the pandemic. But it has been an interesting thing to watch for sure. Um, So I wanted to kind of dive in to a couple other topics, especially with your background, looking at the future of nursing, which is just such an interesting topic with so much to talk about in it. And so just was kind of curious to get your take on the BSN programs and how that has come into play with the nursing profession, and the impact that that's had on skills gaps for new grads, and also kind of for more seasoned veteran nurses that I know many of them that have been practicing with an associate's or a vocational degree for many many years, and now are magnet status has come in and they've got to get that BSN. And so I wanted to get your take on this. I think it's a little bit of a controversial topic in some cases, and so I was curious what you think about that as it coming into play and the future of it.
Yes, certainly. So we talked a little bit earlier about the value of nursing, right? And so the baccalaureate as entry level really came into play in 2010 with the landmark report, Leading Change, Advancing Health. And that was one of their recommendations, was that we have 80% of our workforce at the baccalaureate level. Because we know that higher educated workforce improves patient outcomes, it improves workforce environments, it improves, the work of the nurse, and it helps to decrease some of those gaps in knowledge, skills, or attitudes, those soft skills you were talking about.
Okay.
So our goal was to have 80% baccalaureate prepared nurses. In the state of Arizona, I think we're pretty close. I think we're about 72%, but we're still working on it. And we've done some innovative things even here in the state of Arizona to get nurses at that baccalaureate level. For instance, there's a concurrent enrollment program whereby nurses can take their associate degree and their baccalaureate at the same time, partnering with our community colleges and our universities so that they
Nice.
can graduate with both of those degrees. Certainly, we know the research behind it, and this is why the Magnet is requiring that. And it all boils down to safe, quality patient care, right? That's why we do what we do. And if we didn't have that research to support that higher educated nurses provide better patient outcomes, then it would not be such a big push. But that's the whole impetus, was the work of Aiken and her colleagues.
Mm-hmm. And so, what would be your encouragement to those nurses out there that, have been working in the field for years and now they have a requirement, they have so many years to get that new degree in. And I know that, hospitals have different programs, I mean, depending on the state and depending on the health system, but what would be your encouragement to them that might be a little skeptical of it, or, potentially dragging their feet a little bit on the whole thing?
Yeah, it's funny you bring that up. I remember well when I was getting my bachelor's degree and the people that were saying, "Why are you doing that? It's not necessary."
Mm,
But I'll tell you, for me, it was being able to have a greater sphere of influence.
nice.
Being able to, yes, still care for patients, but having some of those leadership attributes, maybe going into education as a clinical instructor, so the bachelor's really helped me to expand my sphere of influence for patient care delivery and to support my colleagues in other uh, areas such as academia.
Right. Okay, wonderful. That's a great point, great perspective. I think that'll be really valuable for folks to hear. Thank you. And kind of in that same, thought process with the BSN, and now we see a big push for the NP, the nurse practitioner role. And obviously, I think, a lot of what you just said can be applicable to that sphere of influence, obviously, with getting that MP. But, any thoughts on that or trends that you're seeing, obviously, specifically in Arizona, since that's your focus, and the benefits of that for the profession moving forward in the future?
Sure. I think that the nurse practitioner is going to have a lot of opportunities in the future
Mm,
as we begin to fill those gaps of lack of providers or lack of physicians. For instance, there are two major bills that just passed in Arizona that will benefit our nurse practitioners. One is the telehealth bill that allows nurses to provide telehealth services, advanced practice nurses. And the other one is home health, the advanced practice nurses to be able to order home health for their patients. So these are two huge bills that we've been trying to get passed for a long time here in Arizona that supports the work of the nurse practitioner and expands their scope and services.
Wonderful. That's great. Yeah, I think it's a really great opportunity in the profession, and I'm really happy to see a lot of people heading that direction as well. I'm seeing it from a transition perspective. Obviously, with COVID, staffing and career transitions is a little bit disrupted, but other than that, I think it's a really positive thing. So thanks for sharing that perspective. So let's kind of look big picture for a moment as far as, looking at the future of nursing, even kind of where we're at right now, and then looking ahead is what do you see, Dawna, as the biggest challenges facing the profession?
I think we have a lot of concern from nurses at the bedside to the boardroom, and I'm talking about our staff, not frontline staff nurses, all the way up to our chief nurse officers and mid-level nurse managers,
Mhm.
is the psychological well-being. When nurses begin to reflect on what they've just been through,
Mhm.
and then the repercussion. So I think we're going to see a lot of that in the near future. And I think that's a huge concern for our nurse leaders is how do we support our nurses through this journey
Mhm.
of we don't want to call it post-traumatic stress, but post-traumatic growth, right? How do we
Okay.
support them to have a different mindset, have a different conversation on how have we grown throughout this, and then help them to um, relieve some of their anxiety. We have a lot of nurses that just have survivor's guilt, right? And sometimes we segment the patient and the nurse, and oftentimes the patient is the nurse, or
Right.
the patient's or the nurse's family is the patient.
Mhm.
And our nurses were dealing with the same things that many Americans were dealing with. They had small children at home.
Right.
Their husbands may have lost their jobs. I mean, they were dealing with the same social impact as our patients and their families were. And so I just want everybody to remember that. And
Mm.
we just need to support them because um, it was really impressive that our nurses stepped up, stepped out, and did the work that they did during the most vulnerable time that we've seen in the United
Absolutely.
States in a long time.
Absolutely. As you were sharing that, I thought of an experience that I had when I was a recruiter years ago, and I would make an effort, if possible, to go out and meet the folks that I worked with, especially if they had relocated, to the areas where I was in the Pacific Northwest at the time. And I will never forget the experience that I had. I went to meet a nurse that I had worked with, helping her relocate from Texas to Washington, and she wanted to meet after her shift for breakfast. And so I went to the diner to meet up with her, and she she's like, "Oh, we got a patient, I'll be late." And I'm like, "No, no worries, I'm just here, not a problem at all, of course." And she showed up, when she had the opportunity, and we were just sitting there, and it was very quiet, and I just could tell, just reading her, that something was off. And I had never met her before in my life, only over the phone. And she looked at me and she said, "MK, this is surreal." And I said, "Oh," I said, "what does that mean? I'd love to hear, you share more about that." And she said, "I was just fighting for a man's life. And now I'm sitting here at a diner with you." And she's like, "And I just don't know what to think about all that." And it's one of those experiences that I was like honored to share in that moment with her, as much as I wish she didn't have that moment, and
Right.
it gave me this whole new perspective that I value, obviously, to this day. Every time I think about it, I get even emotional. But the more we learned about the trauma informed brain, right, and all of this research that we have coming out, I think that, that is incredibly important for people to understand, and for all of our medical professionals and our frontline workers to really stop and make sure that they're taking care of themselves, because that's exactly it. It's that fight or flight for 12 hours straight, or whatever it might be, or longer. And it's like, how do we support them? How do we heal them? So I think that, in total agreement, it's about finding ways that we can figure that out. And obviously, COVID, another catalyst for really bringing things to the forefront. And so what do you think some of the ways that, you obviously in the profession, on the front lines, fighting and advocating for our nurses there in Arizona, but what is the next step? How do we address this problem? What are some of the solutions that we can look at, even, folks like myself and just the communities, to support these individuals?
Right. Well, first, I think it's doing what we can as a community member
Mhm.
to help the nurses. And I'm going to, CDC guidelines, right? Making sure that we're getting our vaccination, making sure that we're wearing masks. In and of itself, that is a message of support to our frontline staff.
Mhm.
The other thing is to listen. I think that they need a space to feel and to debrief and to reflect and to share their stories.
Huh.
Whether it be sitting at a coffee shop, having a cup of coffee, or they're in a formal, group setting where they're sharing their stories. But I
Mhm.
think it's very important that we allow them the space and the bandwidth to share their stories. There's other things that are happening. I know here in the state of Arizona, and I think nationally, is institutions are looking at positions like chief wellness officers, and providing those resources.
Mhm.
And we know that one size does not fit all. We know that you can't take one initiative for wellness and expect everybody, to be able to benefit from it, that we're all individuals, and recognizing that. So having a multitude of different resources for nurses to tap into is critical, I believe, for
Mhm.
their wellness and their health.
Yeah, absolutely. I love that concept of the debrief. I know, like, even in law enforcement, they have those opportunities, or the military folks. I know they're in the military after an intense, operation or whatever. They debrief, they talk with people, and they have resources available to them. And so I think that there's definitely even some models out there that perhaps nursing leadership can take a look at, and offer some, different resources within each health system. I think would be great. And I think, I'm just sitting here kind of thinking of ideas of even maybe, just having nurses band together and have groups where they can talk things out, and get together, in that kind of group um, space where they can share, in a safe area, and they understand each other, right? They can kind of have that camaraderie as well. So that sounds like a wonderful thing to think about, everyone out there. Maybe you can start a nurse group where you guys could get together. That sounds like a great solution. That's wonderful. So, any other big topics that you think, Dawna, are really impacting nursing and that we should take a look at in our time together?
One thing that I think is really impacting nursing, and is going to impact the future of nursing,
Mm-hmm.
is our students, our
Mm-hmm.
emerging nursing professionals. I think we need to be very careful on how we're transitioning them into our practice settings. We recognize that most practice areas shut down during COVID. We recognize that most students did not get their experiential learning opportunities that they would have gotten traditionally.
Right.
But we have to be very careful not to degrade them or dismiss the work that they did do, and provide them the support and those experiential learning opportunities so that they can grow into the practice arena. So I think that that's something that we really need to think about as we bring in our new nurses and they transition during this, this very hectic time in healthcare.
Absolutely. And we're seeing, again, from my perspective with the focus on travel, I'm seeing a lot of very, new nurses, new grads, even in outside of nursing, but 1 year experience, and they're heading out, to national travel to do things. And, my perspective of someone who's a travel professional is you have some experience under your belt, so that you can kind of go into different situations and have the clinical skills. So, how do you see that as being something that maybe we should all look at and evaluate, as something that might not be the best thing for those students, or maybe I'm wrong? What's your take on that?
Yeah, I think that historically we have had the capacity to tell nurses to go get 5 years of acute care experience,
Yeah.
right? But
Yeah.
I don't think that that's realistic, and I don't think we can do that anymore. I think we
Mm.
need to be innovative, and we need to give them the knowledge and the skills and the attitudes that they need for the work that they're choosing to do.
Yeah.
I think that they're going to be younger and younger entering into specialty areas, and
Mhm.
they may even invent new specialty areas that we haven't even talked about, right? We know that over the past 10 years, there's new areas of nursing that have emerged. And I think with technology, that's going to happen more quickly. So I believe that the practice areas and through residency programs that we can bridge those gaps and we can get people into those areas much quicker
Mhm.
if it's focused.
Wonderful. Good idea, as far as feedback on that, because that's a whole new perspective I haven't thought of with the nursing shortage, right? It's been around pre-COVID. We know that. You're right. We don't have that 5 years anymore. So let's innovate and figure out a way that we can adapt and pivot so that everybody has what they need and can be effective. I love that. That's a great idea. Well, so Dawna, tell our audience, especially our audience, those that are in Arizona, how they can get in touch with you and your organization to be part of this leadership and empowerment for the voice of nursing in Arizona, or even folks that can reach out to get resources maybe for their state and just kind of connect with you in that capacity.
Sure, they can connect with us on our website, aznurse.org. It's the Arizona Nurses Association. We have lots of resources there. We're always looking for to expand our membership base and to give nurses opportunities to grow in their profession, to network with colleagues, and to become involved in the initiatives that we have across the state of Arizona. A couple of initiatives that I would just like to briefly say is our RNconnect initiative, and that is an initiative, psychological well-being, and you just text RNconnect 31996, and you can get tools and tips and strategies on self-care. And so we're
Awesome.
very excited about that. That just launched nationally last week.
Hmm.
And in another initiative is our Fallen Heroes initiative. We'll be doing a Fallen Heroes nurse ceremony on May 12th, Florence Nightingale's birthday. And we're really excited about that because it not only recognizes our nurse heroes that have fallen over this past year, regardless of why they passed, but recognizes that were so important to our patients and our families and our colleagues. And we're very excited about that initiative as well and being able to do that year after year.
That's wonderful. And that RNconnect, I love this. And thank you so much for sharing those initiatives with me in the audience. That's wonderful. Is that something that's strictly for the Arizona folks, or can anybody text that? Tell me a little bit about the dynamic, just because we're nationwide. I just want to make sure we understand.
Sure. There, right now we have 17 states that are involved. And I couldn't name off all the states right now, but it's RNconnect 31996 for the state of Arizona. But you can certainly connect with your nurses association in your state and see if they were involved in the initiative.
That is wonderful. And we'll do some research and put that out there to the audience too, so that they can find if they're in that state and connect with that. Because we certainly love the tools to connect, right? And that self care, as talking about one of the biggest issues facing our nursing friends out there. So thank you for that, Dawna. Well, I really appreciate you spending some time with us today. It's been an absolute pleasure to finally meet face to face on our video chat, and it's been wonderful following you and seeing all the wonderful things that you're doing on social media. So thank you again, and I look forward to connecting again in the future.
Thank you for having me.
Thanks, Dawna. All right.